The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
In a normal year, this week would be March break. Instead, it's just another stretch of families juggling the realities of COVID-19 life. Tonight, Nan Kiwanuka gets some much-needed insight and advice for parents trying to keep all the balls in the air. Then, doctor and author Jillian Horton is with us on her new book about burnout and how physicians can heal thine selves. It's Thursday, March 11th, and that's tonight on The Agenda.
When Ontario locked down last March, few of us expected we would still be dealing with this pandemic. For many parents, it's been a very long year. They've had to be teachers, nurses, full-time caregivers, entertainment coordinators, child psychologists, and more, all while dealing with their own socially distanced lives. Joining us now for some perspective and advice in Bancroft, Ontario, Ann Douglas, parenting expert and author of Happy Parents, Happy Kids. And here in the provincial capital, Tanya Hales, founder of the global nonprofit Black Moms Connection, and Ed Gow Jr., fatherhood expert and member of Dad Central Ontario, part of a national network supporting fathering. Hi, welcome to you all.
Hello.
I am super excited. I feel like this panel is just for me, but it's not. It's for all the parents across the province. And Tanya, I wanted to start with you. You know, this past year, what has been the most challenging part of parenting through the pandemic for you?
How long do I have to answer this question? So I'm a single parent, so I usually don't get breaks as is, but parenting during a pandemic as a single parent means 24 hours a day, 7 days a week with no breaks. It's difficult to manage, my own grief, trying to figure out pivoting my career that I lost. I was an event planner before COVID, not so much anymore. Also, how much screen time is too much screen time. They use their screens for fun now because there's no outside, there's no basketball. So I think there's just a multitude of things that come at you from every angle.
And Tanya mentioned trying to navigate your own grief while helping your child navigate that grief. As a parenting expert, is there one question you're answering more than others, when it comes to how parents are juggling, everything?
Yes, I think the big thing is it just me? Am I doing it wrong because I'm finding it hard 1 year into a pandemic of juggling all these things? And absolutely, you are not doing it wrong. The challenge is that you've been asked to shoulder an impossibly large load, and you've been asked to do it for a very long time.
And Ed, from the fathers that you connect with, what are they most concerned about during this past year?
Everything from balancing work and life, and also for a lot of them too, some of them have lost their jobs. So I'm seeing an increasing amount of challenges mental health wise, and also a lot of fathers, let's be real here, haven't spent a lot of times with their children. So they're still after years trying to get used to being more engaged and being more time-wise with their child or children. So they're still looking for that guidance. They're looking for resources. Would
you say that's a silver lining? Because throughout this whole pandemic, I've been trying to find, the good things to just keep us going for another day. Being able to spend more time with their kids.
Yeah, absolutely. Quick little story. There's a gentleman who lives 3 houses down from me, and he does HVAC. So in the morning time, he's usually out at 7 o'clock in the morning. He doesn't come back till 5 or 6. And about 2 or 3 months ago, we were outside and we were chatting and saying, how are things going with your little daughter? He says, oh, it's been a great time. I've been working less, but I taught her how to ride a bike and I taught her how to ride a motorcycle. I'm going, hold on, she's only 7 years old. She says, no problem. She's got a helmet. But he said he really loved it. And I'm hearing so many fathers around the world giving positive stories of engaging with their child or children.
I would like to say that the pandemic has enabled me to make a home-cooked meal every night, but I would be lying. So, let's take a look at some stats. Last October, Statistics Canada released some numbers ranking how concerned parents were with balancing school, childcare, and work. And the results show that 71% of parents surveyed were concerned about their child's opportunities to socialize with their friends. 64% were concerned about their children feeling lonely or isolated. 46% worried about the overall mental health of their child, and 40% fretted about schoolwork and academic success. And when you look at those numbers, is it notable that parents are more concerned about their children's social lives than they are about their schoolwork?
I think it makes total sense. I mean, I think we're all really craving that human contact, and especially for kids at particular developmental stages. Like, I feel so sorry for teenagers. I mean, this is a time in your life when you're supposed to be being social and having a private life, and the pandemic has forced you to be treated like a 5-year-old. So that must be exceptionally challenging for parents and for teens right now.
Tanya, I saw you nodding.
Absolutely. I think, Anne said it best too, in terms of the socialization, because they learn so much. When they're on a playground, they learn how to win, they learn how to lose, they learn how to deal with peer pressure. You can't learn those things if you're an only child, in a house with an adult who's on a computer all day. And what is this going to lead long-term wise, like how they're going to learn how to interact with their peers when they're in an office setting, if office settings are still a thing in 10, 15 years. So it does make sense. And I know that, teachers and boards are doing the best that they can to try and make sure that children don't fall behind. I know that some kids are flourishing in this virtual learning because they're not good in classroom settings, whereas other kids, now that the classroom sizes are smaller, they're getting a little bit more attention. So we don't have to necessarily worry as much academically as we do for the other extras.
Tanya, you mentioned that you are a single parent. How are you managing to be productive while doing everything else that you've had to deal with your son?
Define productive. There's days where I just give myself the grace to say, I don't have it. I might follow up with people saying, you know what, you're going to get this by end of week. So I can give myself an extra few days. I try to use calendar schedule tools so I can know what my schedule is like. I make sure that times are blocked off for drop off and pick up times from school. I try my best, but it's really, really difficult because sometimes it's just, getting out of bed and putting food in your mouth for breakfast is the only thing I can accomplish. And some days that has to be okay.
And I've also been hearing, even for me personally, my days are very long. And Ed, we've heard how in two-parent cisgender relationships, women are still shouldering most of the work. Why do you think that is?
I think one of the reasons is a lot of fathers don't know where to start. And a lot of things, too, that they haven't been taught. And also, too, a lot of fathers haven't had that experience when they were raised by their fathers. So a lot of times they've been so, unfortunately, focused on providing, especially providing through the workplace, that they haven't thought about there is another side of life. So they think about the traditional this, and this. Now with the pandemic, sometimes they feel like they're a father out in the middle of the sea and they don't know what to do. The kids are coming to saying, daddy this, daddy that. And sometimes, unfortunately, the father hasn't paid a lot of attention to what's going on with their child or children in school, in everyday life. So it's not a perfect situation for anybody. But as I said, and we'll get to later, more dads are getting engaged now. So that's a good side of the pandemic. And
Anne, Tanya mentioned the screen time. We've all, I think from the time that I have my kids, my eldest is 10, limit screen time. But now screen time, learning, their friends, it's a connection to the outside world. How can parents balance screen time with physical activity?
Yeah,
if you can get outside.
Yeah, exactly. I think lose a little bit of the guilt around that, because I've had so many parents say to me, for years we've been hearing all this stuff about, limit the screen time in this way. And I think the wisest thing I've heard is to look at how the screen is being used, as opposed to just narrowly counting, setting like a stopwatch or something. Think about, like, are they connecting with family across the miles, or is this their friend hangout, as opposed to just treating scrolling through Instagram and feeling badly because your post hasn't been liked as the equivalent of playing a card game remotely with your grandparents.
I think for a lot of us, when we were growing up, our parents would say, "I'm not your friend, I'm your parent, go outside and play with the kids down the street." But now the pandemic has changed the dynamics so much that parents have had to be their children's friends. Do you worry about what that would look like in the future? Do you think that's going to make children more dependent on their parents, Anne?
I think that there'll be a little bit of an adjustment coming out the other side, but I guess I have such faith in our wonderfully flexible and plastic human brains. I mean, we are able to learn and adapt, but I mean, I think that we really will need to make an investment in schools and in, mental health supports, because there will be some children who don't just naturally pick up for missed ground. I mean, all 4 of my kids grew up with some kind of mental health, neurodevelopmental, or behavioral challenge. So, it's not easy necessarily for every child.
And Tanya, I see you nodding.
Yeah, absolutely. Like for my son, he asked me to download the Among Us game because he wanted to play together. And that's not my jam, but this is a way for us to connect on his level and have something fun for both of us to do. And I do think that this is an opportunity, like Ed has been saying, to get to know your kids a little bit better. Traditionally, we used to drop our kids off at daycare. We would go to work, we pick them up from childcare, feed them dinner, go to bed. We were seeing our children maybe an hour or two every weekday, and then, rush on weekends to spend time and get to know who they are as kids. What are their interests? Who are they? And of course, they change every day, just like we do. So there's definitely opportunities, but I think that it's going to be interesting to see what the long-term effects of all of this is going to be on children, interpersonal relationships with us as their parents and also with their peers.
I mean, it is, Tanya brings up a really great point. It is an opportunity for us to get to know our children better and for them to get to know us better. But Ed, from the fathers that you've been speaking to, how can kids nurture friendships or even make new friends during this time?
Well, they can make new friends, but the parent or parents have to monitor the friendships. Like, we can always make new friends, but the parents have to be engaged. This right now is the time to build the foundation for the future. So the actions that fathers or parents are taking now is going to set up your child's future. So as much as possible, be involved. Don't be overbearing. And like last night, it was online, and I was asking parents, how are you surviving during the pandemic? Some of them have, said, we're right in there, but others have said more and more now, we're giving our children some space. So we're just overseeing. They're allowing them to grow, and they're just managing. They're not there hands in every day watching everything. But another thing I say to parents is, at the end of the day with your children, ask them what's a win you had today. Tell me about your day. So they feel that the parents are involved in their development and how they're doing. And those are the little things set up for big things. So if you do the little things right, it'll set up for big wins further down the road.
And, and for some communities, they're not just navigating the pandemic. We know from reports that the pandemic is disproportionately affecting Black and Brown communities. We've also, last summer, we saw the Black Lives Matter movement go global. What advice would you give to parents in how to talk to kids about this, Ed?
My advice would, first of all, if you're not comfortable, talk to other parents and see how they're addressing it. See what's working and what isn't working, and have the talk with your children. And if you don't know the answer to some questions, tell them you don't know, but see if you can get back to them. But you want to make sure that the information they're getting, you're making sure it's coming from you, not from some media source. And you want to show that you're involved in their lives and you want the best for them and to prepare them. So when the pandemic goes in the next stage, you have prepared them for some of the things that are out there that they're just seeing on a screen now. They may be encountering face to face after this next stage.
And Anne, what advice would you give to parents on how to talk about all the other stuff that's happening in the world?
Oh, I would say to really lead with your values. Think about what kind of family you want to be and how you want to be making things better in the world, and look for concrete day-to-day ways to live by those values, because it's not enough to just say, oh, that's terrible that this thing happened. Think about, your responsibility as a family. And I mean, I guess I get frustrated sometimes when people think it didn't affect my family directly, so I don't need to care about that. I want to be part of the kind of world where we all care deeply about one another, and where we're looking out not just for our own individual families, but for every family, every parent and child in the village, right?
And Tanya?
I can
Oh, sorry, Ed, go ahead first, and then we'll have to.
Yeah, I just want to add another thing, and also have those family discussions. Ask your children, what do they think about that situation? Get their input, because sometimes they may know than you do, and they may end up teaching you about some things. So get their perspective and show that you value what they're thinking, and work together for understanding together.
And Tanya?
Yeah, I think you have to arm your own toolbox, right? You can't answer questions without having, prior engagement. Do your own reading, your own learning, YouTube, books, etc. When it comes to talking to your children, let them lead. Let them ask you questions. And like Ed said, if you don't know the answer, say, I don't know the answer to that question. Let's find out together. Do an audit of what's around them. Are they watching diverse TV shows on Netflix? Do they have diverse toys in their toy box? Do they have diverse books on their bookshelves? You're the one who bought all those things. So, you have to challenge yourself to say, wow, I really have only been giving them, entertainment and things that look like one set of people. And, there's tons of resources out there. Today's Parent has a great post about how to talk to your children about race by age, because you have to make it age appropriate. You're not going to talk to a 5-year-old about slavery, but they have a staunch sense of fairness, and it's like, oh, is that fair? Is that nice that someone doesn't like someone else because of their skin color? No, it's not. Okay, let's talk about that. It can start and end there, but this has to be, like Anne said, this is not just a conversation that parents who are Black and Indigenous and of color have to have. This is a conversation that every single parent has to have with their children, because we want, when our 8-year-olds and 10-year-olds become 20-year-olds and 30-year-olds, that we're not having this same conversation about how do you talk to your children about race. They're going to learn to have grown up in a world where representation mattered.
That's really an interesting point that you bring up, because I spoke to a cousin of mine, and she decided not to talk to her children about what was happening in the world around Black Lives Matter, around the violence with police. And I actually spoke to my son, and then he became very afraid. Every time his father left the house, he would be very afraid, when is he coming back? Can I go with him? So Ed, again, I guess one size does not fit all.
No, absolutely not. And again, get to know your child or children. Everyone is different. And again, if you're having those challenges with your children, there are online resources, there are agencies that are open, and other parents. You have your village, have your community, because this is a communal effort. You can't do it alone, because if you do it alone, you're going to get burnt out and you're going to get frustrated, and your children are going to sense it.
I think for parents too, they are navigating so much. So I think they know that their friends are navigating a lot as well. And is that something that you've seen, where people don't want to burden other people because everybody's just trying to do the best that they can?
Yeah, and I know often, because I'm somebody who struggles with anxiety and depression myself, when you're in that dark place, it's easy to retreat and to pull back, when really what you need to do in order to feel better is to actually lean into your relationships and say to people, I'm having a really hard time. So I think that just know that you may be sort of retreating for a reason, because you're having a hard time, and look out for one another. Like if you notice a friend goes quiet, reach out to them and just say, hey, just, wondering how your day's going, that kind of thing. Even just idle chit chat matters a lot in a pandemic, right?
Well, I mean, one thing that we've been hearing throughout this pandemic, and I mentioned it earlier, is that kids are resilient. We know that Kids Help phone line has seen a sharp increase in the use of its helplines since the beginning of the pandemic, yet we're hearing kids are resilient. Why is that, Anne?
Well, kids are resilient, but they're resilient in a context when they feel adequately supported by their parents and their community. It's not like you just have like a little shrub of a child who's growing in isolation on their own. There need to be the nutrients in the soil. So we need to be putting all the supports in place that parents need in order to feel supported and that kids in turn need as well. So I sometimes feel like we download a lot onto parents and just sort of, or give them false hope when we're not making the necessary societal investment that parents and kids really need right now.
Tanya?
Yeah, I think people say kids are resilient because, the opposite of hopelessness would make it that much harder to deal with, right? It's just like, no, the kids are going to be okay. It's more saying the kids have to be okay. Because otherwise, I'm an adult. I have coping mechanisms. I can, partake in a glass of wine. They don't necessarily have the same tools to decompress. They don't have, some of these kids, my son's only 8. He doesn't have a cell phone. So he can't just pick up the phone and call a cousin to talk. He's got different tools where he can communicate with the outside world. But, of course, they're limited. And so we have to really just, when we're talking about resilience, a lot of times in the Black community, we hear, oh, you're strong, but strong is not necessarily an armor that protects you from grief and sadness and depression. And when we're going through a global pandemic, as a parent, as a person, this idea of resiliency, we need to kind of really think about, well, when we talk about resiliency, what do we really actually mean?
And Ed?
Just adding on what the two ladies said ahead of me, this whole thing of strong men, as I say, even strong men suffer. So what I say to everyone out there, parent, especially at this time, is yes, it is a difficult time and everyone's going through it. And in this time of the history, there's nothing in the world historically that's affected everyone directly or indirectly. So everyone has gone through it. And as the two ladies have said too, reach out for that support. Resilience. We only see the resilience on the outside of a lot of people. We don't see what's going on inside.
Mm-hmm. And so when we do talk about how we get to the other side of this, Ed, how important is it to have a community or at least a few other parents to just talk to?
Absolutely critical at this time. From the father's side, one of the platforms I'm on, every day at 10:05 a.m., we have an open room and it's called Are You Man Enough? And it's a room where fathers and men just share their challenges. And we have men on from all around the world. Actually, I'm going to be interviewing one of the men on my show from Bali, who is a fatherhood there. And just all the different sharing. It's so critical because there are a lot of people right now, and we have to be honest, that are alone right now. And if you're not hearing from someone, as Anne said earlier on, one of the things I do with the fathers is I'll text them and just say, you're good. Just to reach out to know that someone cares. So it's absolutely critical. We didn't come in the world by ourselves, so why are we trying to do it by ourselves?
And when we do talk about mental health, we also know that a lot of people are struggling financially because they've lost their jobs. And Tanya, I've seen you with Black Moms Connection fundraising for mothers who might need to make their rent or their mortgage. How important is it to have a community or at least a few other parents to talk to, Tanya?
Oh, yeah, absolutely. I mean, Black Moms Connection was born 6 years ago when we could still do things in person. And, obviously in the last year, so we were kind of ahead of the curve in terms of building a virtual community. And it's become, some folks, they tell us it's the only reason why they keep Facebook. It's their go-to source for culturally relevant information on motherhood, to be able to ask the questions that you're afraid to ask your family members because you feel shame or you feel guilt. You can do so anonymously, which is a new tool that Facebook has given parental groups. So you can put something up and now you can have 17,000 women, chime in, give you support without, them going to your Facebook page profile to creep to see who you are, if you're connected to them in any way, shape, or form. So when we launched our grant programs last year, our emergency grants to buy just food, formula, our rent bank program to pay the rent or mortgage of anyone who's lost their job or is at risk of housing insecurity, these asks for financial support, of course they spiked, and we did as much as we could with our corporate partners to be able to provide just some small reprieve. And it makes a really big difference, because we know in our community specifically, if the moms aren't healthy, then the babies, whether they're 2 or 20, they're not healthy either.
And we always like to try to leave on a moment of just to offer some hope from people who are watching and listening. Tanya mentioned earlier that parents are navigating this grief. Our children may not necessarily have the language to say, this is what I'm feeling, or this is how this is impacting me. So how can we help our children navigate this grief?
I think just to let them know that they can bring all their emotions to you. I think sometimes kids feel like my mom or dad is already really struggling. Like, do they really need my heavy emotions? Yes, bring those emotions to me. I'm strong enough, I'm big enough to be able to carry them for you, so that you can just, be a kid. And I think just to give them permission to, to just be themselves, to do the best they can, but not with the pressure or expectation. Let's just give ourselves permission to be gloriously imperfect parents, and our kids permission to be gloriously imperfect kids. Nobody needs to be perfect in this moment.
Oh no, we just have to, put on some pants and a t-shirt and our mask, and we've done well. We talked a little bit about silver linings, and Ed, I think this is an opportunity. A lot of people have been saying this is an opportunity to build back better. Would you say then, looking back on the past year, that it's been a 1 year of teachable moments? And if so, what are those moments?
Been a whole year of teachable moments for a lifetime. I think one of the things I say to parents is, remember to give yourself grace. Give yourself grace. I say that whether it's a father or parents, I always end off my conversations, remember to give yourselves grace. And when I say that, a lot of them just exhale saying, thank you, someone said that. I needed to hear that. And I think teachable moments, enjoy learning with your children. Those moments, because you're never going to have, every learning moment is never going to be repeated, but also be confident with your children. And also it's a time for parents to look at themselves and say, let me just take a look at where my compass is. Is a compass in the right direction? Am I not spending enough time with my kids? This is teaching me now that I need to invest in the greatest thing in my life, my children, the future. And also, let's take the time to get to know our families. This is a great time to know it. And I know not everyone's in that space. And then one parent told me last night, middle of the day hugs for your kids.
The best, the best. Tanya, I'll let you have the last 30 seconds.
Sure. I think also, too, is if you can't be the safe space that your children need, and I've said this to my son, like, hey, sometimes you're not going to like me. You're not going to want to talk to me. Call up your uncle. I have a partner in the US. They have their way to kind of message each other. Just let them know that if you are not their safe space, even though that you are, like Anne said, you can come to me with your sadness, with your anger, with your whatever feelings. But if you are not that for your children, then at least let them know that they have other places that they can go as well.
Thank you so much for all of your insights. I'm pretty sure there are parents across Ontario just breathing a sigh of relief that we're not alone. Thank you so much. We appreciate it.
Thank you.
Thank you.
Doctors put in grueling hours, routinely face life and death situations, and endure intense physical and emotional demands, never more so than during a global pandemic. What is less well known is how they handle it all. Dr. Jillian Horton is an internist and medical educator, and now author of We Are All Perfectly Fine, a memoir of love, medicine, and healing. And it brings her to our virtual studio tonight from Winnipeg, Manitoba. It is great to meet you. I absolutely love the book. How you doing, Doc?
I'm doing okay. Thanks so much. It's great to be here with you.
Not at all. Now, I must tell you off the top, I've talked to lots of doctors over the years, and And almost all of them get into medicine for a very particular and often a very personal reason. And I know, having read the book, that is the case with you. Why don't we start there and you tell us how and why you got in?
So I grew up with a sister who was profoundly disabled. She had a pediatric brain tumor, and from the time I have really my earliest memories, I had a ton of exposure to seeing how the medical system treated her. And while there were some really compassionate and wonderful doctors in the midst of her care, there were also a lot of encounters with the medical system that were awful, that were devoid of compassion. I saw the stress that it created for my parents, the moral distress. I saw the humiliation involved on the side of our family in those encounters when we sort of were depersonalized or felt dehumanized. And it really gave me an inside knowledge that I hit a point in my life that I just thought, I can't have this understanding of what's wrong and not somehow use my abilities to try to fix it so that other families don't go through the same thing.
When the encounters were bad with people within the healthcare system, what did you attribute their inability to be human with you to?
Well, when I was younger, I really saw this as just cruelty. I saw it as ableism. I saw it, although we didn't even have that word in our vocabulary at the time, but it was certainly clear to me that people attributed a lot of the issues that my parents would continue to bring to physicians and to other members of the healthcare team, that people just attributed that to like my parents being troublemakers or my sister being a really difficult case or a difficult person. She really had an acquired brain injury after her brain tumor. She had a postoperative meningitis, so she had a lot of behavioral issues, and people just sort of blame my parents for that. A lot of different specialists would frame it as if, my parents had just never taught her manners or didn't teach her any way to control her behavior. So looking back, certainly some of the problem was ignorance and just a lack of understanding of the complexity of head injuries. It wasn't until much later in my own career in medicine that I began to understand that at least some of those behaviors, and I would never make an excuse for them, and I don't think it is an explanation for all those behaviors, but I think some of them at least could be explained by physician burnout.
Okay, we're going to get to that more, but I do remember reading in the book probably the worst thing one doctor said to either you or your folks about the status of your sister's brain. You want to share that story?
Yeah, so this is part of my family's lore. This is something that happened before I was born. So my sister, after her brain tumor was removed, she actually had a very kind and compassionate surgeon and pediatric neurologist in London, Ontario, and then came back to Manitoba. And at one point during her very long, prolonged convalescence in the hospital, a physician took my parents over and showed her some scans and basically yelled at my parents, "Can't you people get it through your head? This child has no brain left." And that story, perhaps more than any other that my parents told me about their encounters with the medical system, was one that resonated more than anything. I think even all through my training, I thought no family member should ever be subjected, no patient should ever be subjected to that kind of cruelty, that kind of language, that kind of experience from the medical system. It's traumatizing, and it leaves lifelong scars in patients and families when they're treated that way.
So that was pretty clearly very motivational for you to try to get in there and do it differently, yes?
Absolutely, absolutely. And I always thought of myself when I first went into medicine as a bit of an outsider. And I'm not saying I was, once I began my studies and carried on in my residency, I have had hundreds of colleagues, thousands of colleagues probably, if I really started to look at every wonderful person I've worked with in allied health and nursing and members of the healthcare team, nurses, aides, physician colleagues who represent the best of medicine, the best of compassion and the way that we would all want to be treated. So I found those people too. But of course, alongside of them, I also saw this other ugly side of medicine, the way that people would sometimes speak about patients, the way that, just like my family, having been described as having been perceived and treated as if we were, my parents in particular, advocating for my sister as if they were difficult or demanding. I saw a lot of that side of things too. And there was a big part of me that was continually motivated by that, but that also this was a wound that went on and on. Every time I saw a patient that reminded me in some way of that experience of powerlessness that my parents had had, that I had experienced as my sister's advocate at different points, as her sibling. Every time I had those experiences, they would continue to probe that wound and make me reflect and just think, why does our system have to be that way? How has it come to this?
We are, I promise, going to talk about the issue of physician burnout, which is, after all, what the book is about. But I still want to tell a bit more of the story, or have you tell it, on how you got there. And one of the things I'd like us to touch on now, some doctors form very deep bonds with some patients. And some of your stories in this book are just incredibly touching in the way that you did that. And I wonder if you could share with us the story of Michael, which was, oh my God, this is just, anyway, the floor is yours.
One of the things that I sought to do with this book was write about a couple of patients that I'd cared for 20 years ago, and I had to track down their families. And for me, this was just really a profound experience. This is a real gift that they gave me to allow me to write using their real names and their real stories. So that has been an amazing part of this book for me. But the story that you allude to, and one of the central stories in the book, is that of a patient by the name of Michael. And Mike was a patient with cystic fibrosis. I met him when I was an intern, still very much during my formative years working at St. Michael's Hospital on a respirology rotation. And Mike was around the same age as I was and had a lot of the same interests. He wanted to be a filmmaker. He was really interested in the cinema. And sometimes, even when I wasn't on respirology and went on to other services, because Mike was in the hospital so much, he would be in the coffee shop playing cards or reading. And we just, after I had been on the rotation that he was a patient on, we knew who the other person was. And then sometimes late at night on call, I'd be there and I'd sit down and start talking to him. And then when I went on to another hospital for my next clinical rotation, he was a patient at that hospital a few months later getting a transplant. And so not only did he keep popping up in my clinical life, but we connected on a personal level. And Mike would send me postcards and letters. We would email, we would talk, and I got to see him have a lung transplant and have a significant, profound return to, come back from this severe illness, this sort of one foot in the grave situation that he was in, and come back to looking like a healthy person, just the way I did. But then after several months of his return to normal life, Mike became ill again, and I was not able to connect with him before he died, which was when I learned that afterwards, and happened to learn of his death in passing, was a hugely devastating experience for me, and something that I really carried as a profound weight for years and years after that. And at Chapin Mill was actually one of the first places where I ever really discussed the loss that I felt with Mike and the profound grief that I felt after he died. And actually, one of the really lovely things when I tracked his surviving brother down and connected with him was his brother he found a few notes that I'd written to Mike in his things, and he actually sent those to me and mailed them to me. And it just, I think, is such a testament to the fact that we care for these people, but they come with us And if we never do anything in the future to tend to those unresolved losses, we never talk about them, we never think of them as ours, we're sort of disenfranchised, you can begin to understand the chronic cumulative grief that doesn't go anywhere, that isn't really managed. It's not really physician culture to manage it. So that is a big part of what I went through in this book, and what I've learned to do since my first trip to Chapin Mill is work differently with a lot of these unresolved tragedies, just learn to respond to them, to see them differently and process them differently in my life.
We've mentioned it a couple of times, so let's go there now. Chapin Mill is this place. It's actually not that far from here. It's in upstate New York, I guess between Buffalo and Rochester. And it's the place where you found yourself, along with many, many other doctors who felt burned out and needed to heal. What was it that finally got you to admit that I am in a disastrous place and I need help?
Yeah, it was kind of a chance encounter, actually, and for a few years before I first went to Chapin Mill, I had been a student affairs dean at my medical school, looking after hundreds of medical students and feeling vicariously their emotional challenges and their distress as they tried to navigate medicine. And I really began to look at what's out there, like what is actually going to help that I can teach to these students, because I sometimes felt that even though I had an almost bottomless well of compassion to share with them and to model for them, I also didn't exactly know how to deal with some of my own building distress and some of my own sense that medicine was beginning to take a greater toll on me than I could really bear. And so as this was all building in my life, a physician who is one of the founders of that program in Rochester happened to be giving rounds here in Manitoba and was doing a workshop, and a friend urged me to go, a friend who practices mindfulness, who works in healthcare herself. And I went, and I really liked this guy. I thought he was funny, he was cool. I sort of expected him to be a bit flaky and granola, and he wasn't that way at all. And he said to me, "You should come to Chapin Mill. I hope you'll come." And I, on a whim, thought, I might as well go. It looks like a nice place. And I made the arrangements, surprising a lot of people in my life, that I would go to something like this. And I went with, I think, a bit of cynicism in my mind and my heart, not really expecting it to be a profound experience, expecting it to be something that I would come home and chuckle with some of my more cynical friends. And in fact, I came back from that first trip with an intent, and maybe with, for the first time, some skills to make a profound change in my life in terms of how I dealt with the ways that medicine affects us.
Well, before you got there, you were a bit of a tough customer, I have to say, because they told you to leave your phone in your room and you wouldn't do it. You kept it with you and you kept sneaking looks at it from time to time. But what essentially did they have you doing over the 5 days that you were there?
So we do 3 main things in this program. And I've been back more than once. And actually, I've done some training, quite extensive training actually now, to teach that program. And I teach it to physicians both locally and nationally and all over North America now, which I also would never have imagined would be something that would happen. But we do 3 main things. And one is we do meditation together. We do formal and informal meditation, some of it sitting on the cushion, some of it other kinds of meditations, walking meditations, things where you focus on particular things in your environment. We do a lot of paired structured storytelling. So sitting down with a partner in a confined period of time, just the way I describe in the book, and sharing a story in a particular way using particular tools. And one of those tools is looking at stories from a strength-based approach. So instead of what we typically do in medicine, because we're all heavily type A and extremely driven, we tend to look at stories in our lives through the lens of failure. When I look at stories of things that have gone wrong with patients, I look at mistakes that I've made and things I wish I'd done differently. And there's a big reframe that happens at Chapin Mill, which includes looking back at some of our losses, some of our traumas, some of the cases where we really wish things had gone differently, and instead focusing on learning, focusing on what we actually did well in those moments, and looking at how those stories fit into the bigger pictures of our personal development in our lives. And this might seem basic, but this is not something that comes naturally to most physicians.
I did wonder, given the type of personality that tends to go into medicine, as you've just described it, how long does it take before you stop saying to yourself in this idyllic surroundings, boy, this is a lot of airy-fairy crapola, and I just can't buy into any of this? How long does it take to lose that attitude?
Well, for me, the first time I went down, I would say it took about 3 days. So for the first couple of days, like you said, I was looking at my phone and I was still thinking a lot of these people are really weird and what's their deal? And, something interesting happened. Like by the third day of doing those practices and doing some of the meditation experiences, I noticed I started to feel better. And I don't mean I felt suddenly magically relieved of everything that was distressing. I just noticed little bursts of peacefulness, of calm. And it suddenly made me aware of how rarely I felt that kind of peace and calm and sense of well-being in my life. How the word addicted is maybe not quite the right word, but how just accustomed I was to feeling awful, to living with chronic stress, to always worrying about what was happening at the hospital, to perseverating about the students that I was tasked with looking after, to worrying about whether there was something on a clinical service that I'd just been on that I might have missed or that I could have done better. And this was the first time that I really had begun to believe in these small glimpses that maybe there's a different way to exist. Maybe this is habitual. Maybe my brain, having been wired this way over all these years of working in a chronically overstressed environment, maybe I have a choice in that. And again, when I say that now, it doesn't seem like that big of an idea. But at the time, for me, this was a profound reframe. And actually, I think it's a profound reframe for a lot of physicians. I think a lot of us have become so used to living this way that when someone suggests maybe there are a few things that we could do to make ourselves feel better, that are meaningful, that are impactful, even that idea is overwhelming. And it's also really threatening in a sense, because so much of what causes our distress, like if we look at physician burnout, we know that 80% of the problem is related to the system factors, medical culture, organizational factors. It's not a problem of me not being resilient enough. This is another falsehood that sometimes has permeated medicine, that when we struggle, that it's because we're too weak, that we can't handle the pressure. And when we look at studies on physician resilience, physicians are actually more resilient than their age-matched controls. And there's been a lot of excellent data showing this. So when you say to yourself then, well, the problem isn't that I'm not resilient enough and I'm really suffering, so the system needs to get fixed. System change happens really, really, really slowly. We can make personal change a little bit more quickly, and then personal change allows us to be more effective as leaders, making that system change. So those are all thoughts and concepts that gelled for me in a really important way during my first pilgrimage and subsequent trips to Chapin Mill.
Well, here's an excerpt from the book that I think amplifies on that message that you just gave us. So, Sheldon, if you would, let's bring this up. And here's an excerpt from the book. Burnout isn't a clinical diagnosis, right? It's a phenomenon. But you take a bunch of people who are altruists and perfectionists and have the same baseline predisposition to mental illness as the rest of the population, and you put them in, quote unquote, jail for 5 years, and you script everything they do, right? You limit their sleep, you limit their food intake, you cut them off from their loved ones, they kill a few people by accident, and you tell them everything is their fault. But if they keep their mouths shut, maybe nobody has to know what they did. But in return, they have to take over running the prison, do it to the next generation. That's a pretty awful indictment on the system in which you make your living. Why would anybody want to become a doctor knowing that's waiting for them?
That's a great question. One thing I would say is I don't think most of us do know that that's what's waiting for us. We don't really understand this culture until we're deeply immersed in it. And then the problem, of course, becomes we don't see the culture because we're deeply immersed in it. We no longer understand it. We're the fish who can't really describe water because it's everywhere around us. So that's the first thing. I think a lot of us don't really understand the kind of emotional deformity that may occur to us that may occur during the course of our training. And so we plunge right in. And there's another thing that happens, and this passage that you've chosen sort of touches on it. And it's the idea of a cycle of retribution instead of restoration. And this is a big pain point, I think, for a lot of physicians in older generations. We're looking now at doing things like, and in some places we have done things like limiting call shifts, limiting a call shift to no more than 24 hours of being awake. And in some places, sometimes our residents will be capped at 16 hours, which is still a pretty long shift when you think of the kinds of things that they're doing. But there can be a lot of tension because sometimes older physicians, and I'm decidedly mid-career now myself, can look at this and say, well, I had to do this. I had to stay up for 28 hours. I had to do 1 in 4 call in the hospital. Nobody limited my patient load. Why should these other people have it better? This is a knee-jerk reaction that comes out of, again, it comes from a place of pain. It comes from an unmet need. And I think sometimes when I try to analyze the roots of it, I think when we go through any really horrible experience in our lives, sometimes to try to create a narrative that allows us to conceive of ourselves as having been in control, we say, well, I learned a lot from that. That adversity made me a better person. Now, our adversity in our lives, I mean, most of us, the really difficult things that we've been through, we can also trace some of our best qualities to those experiences. So it is true that difficult things that we go through can lead to profoundly wonderful characteristics in us. But the flip side is there does come a point when that can no longer be true. And so I think a lot of the time physicians are saying, well, this made me who I am, and they're just blind to it. And I would also say, my residency, the entirety of it was not horrible. I had many wonderful experiences. I had some incredibly compassionate, amazing, profoundly wonderful mentors and some amazing times and some deep relationships that formed with colleagues who are still among my best friends during those years. So people, I don't want to frame it as if it was all awful, but it was brutally hard. And I don't think it has to be that hard. I think a lot of what we have made difficult about medical training, the profound sleeplessness, the emotional repression, the kind of volume, the caseload that we sometimes are expected to carry, we can change those things. It just becomes a question of, is our culture ready to acknowledge that things about it don't have to be the way that they have been, that it's a fallacy, that it has to be that way.
Dr. Horton, COVID-19 has obviously made things a lot worse for people who work in healthcare, doctors in particular. The stress must be unbelievable. I talk to doctor friends of mine who say they are just inundated all the time. Do you think the problems that sent you to this retreat in the first place are, how much worse would you say they are right now in a pandemic?
I think that's what is such a crisis for us in terms of COVID. It's that we were not in good shape going into this. We should have been ideally in the way that you would feel at mile 1 of the marathon. And instead, our general shape was a lot more like mile 24. So I think that is a significant part of what is happening to physicians and all healthcare providers right now. By the way, I talk about physicians because that's the data and literature that I know, and certainly nurses and all allied healthcare providers are really struggling. But we know that doctors going into this were in a burnout crisis. It's been called a public health crisis by many large bodies in North America. The data tells us that. And I think this is going to be one of our tipping points. I think we're going to see, as I've written elsewhere, a wave of early retirements. I'm worried that we're going to continue to see, we've already seen physician and nurse suicides tragically, horrifically in Canada since the pandemic started. Physicians already have one of the highest rate, the literature seems to say, among white collar professions for completed suicide. So that's my biggest fear. And it was my fear just a few months into the pandemic, that this was going to be a perfect storm for us for either tipping people into disaster Or a more hopeful interpretation is to force our hand as a profession to really begin to look at some of the problems that we have dealing with, stigma and mental illness, issues with physicians not wanting to disclose mental health diagnoses because of licensing issues, very real concerns there. And it's quite possible that the stress and distress associated with the pandemic is going to be a cause of positive transformative change ultimately in terms of how physicians see seeking resources, in terms of what organizations see as their obligation to provide resources, to provide support, and how we handle our own stress and distress going forward.
Dr. Horton, the time has flown by, and I have one more question left, and I want to pluck it right out of the book because I take it from a conversation you had with a guy you're calling Roy. And you really do ask two fabulous questions here. Do you think the problem is we're holding ourselves responsible for things that aren't our fault? Or is the problem that we need to forgive ourselves for the things that actually are our fault? Did you ever get to a satisfactory answer to those questions?
Well, I think most emotionally intelligent physicians that I know who are still carrying the kinds of patient stories and experiences that you allude to, Steve, and the ones that I shared in the book, I think we do all still have work to do on forgiveness. I think most of us still have taken responsibility for things that aren't actually our fault necessarily in our personal histories. And I think that we are also working in an impossible system. And I hope that one of the restorative things that we all, everyone in medicine, everyone in a position of leadership in medicine in the coming years, I hope we take it upon ourselves to try to create a system that is different for the future generation, that we see that not as something that we're giving up, that someone doesn't have to go through what we went through, but that we can reframe that and see that as a gift, not only to those learners, our students and our residents, but also that we can see that as a gift to patients. Because if the system can become more compassionate, it will allow physicians and all healthcare providers to have more compassion for themselves, and then everybody will win.
They could start with reading this book. I think this ought to be required reading for anybody who wants to go into healthcare. We Are All Perfectly Fine, a memoir of love, medicine, and healing. Dr. J, that was really outstanding. Thanks so much for joining us on TVO tonight.
Thank you so much, Steve. It's absolutely my pleasure. Thank you.
And that is the agenda for Thursday, March the 11th, 2021. Which trumps which? Luck or skill? Tomorrow, Nam Kiwanuka talks to the New Yorker writer and author Maria Konnikova about what she learned about luck and life from her foray into the world of playing professional poker. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org. And Nam, we'll see you here tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.